I'm Mary. Hi, I'm Mary Lay with the Indiana Problem Gambling Awareness Program at Prevention Insights at IU Bloomington. I share space and colleagues with the staff of the American School Health Association, and I'd like to welcome you all here today for our webinar. Our webinar today is the Jed Foundation's Comprehensive Approach to Mental Health Promotion and Suicide Prevention with two wonderful presenters. The mission, I want to just briefly talk about the School Health Association. The mission of the American School Health Association is to transform all schools into places where every student learns and thrives. The American School Health Association envisions healthy students who learn and achieve in a safe and healthy environment, nurtured by caring adults, functioning within coordinated school and community support systems. I want to remind everyone that the Asha annual conference is coming up. Again, this year, our conference will be virtual. It is going to be on July 19th, 20th, and 21st, and there's still an opportunity to register. You can register at the Asha website. There are many benefits to being a member of the American School Health Association, including the Journal of School Health, JOSH, an association peer-reviewed indexed professional journal available both in print and online. Continuing education opportunities. Members receive free continuing ed credits, including JOSH, self-study webinars, and the annual conference. I take advantage of that with my certified health education specialist. Discounts on various publications, including AAP publications, as well as discounts on the School Ed Network, Sex Ed Network, and job postings on the Career Center. Information and expertise is available. Access to the latest in school health through our annual conference and biweekly newsletter. Today's presentation is being brought to us by Emily Bader and Dr. Okoya. Emily has been with the Jed Foundation, working closely with high schools. Sorry, I need my glasses. Sorry, guys. Emily joins the Jed Foundation with 6 years of experience working directly with high school youth and public schools across New York City. Prior to being with Jed, she was the senior program manager at the Big Brothers Big Sisters of New York City, where she was responsible for managing several corporate mentoring programs, which including facilitating workshops for over 70 volunteer employees and student mentees. Emily joins the newly formed led high school implementation team as the inaugural high school advisor. Emily is a licensed social worker and received her BS from the University of Wisconsin in Madison and her MSW from Yeshiva University, Wolitzer School of Social Work in New York City. Dr. Okoya joins Jed after 11 years of working in and with schools in communities of color. She started her career as a middle school teacher, and after seeing the health disparities that affected her students and their families, she decided to pursue her Master of Public Health degree from the Columbia Mailman School of Public Health, and later her Ed.D. in Health Education at Teachers College, Columbia University, where her research focus was on the adoption of trauma-sensitive practices in New York City schools. Most recently, she led the Children's Health Fund, where for 6 years, she helped build and run a school-based program. She has trained over thousands in school professionals, presented at various national conferences, twice at Asha's annual conference, and teachers at SUNY Lehman College and Columbia Mailman School of Public Health. I welcome our presenters for today.
Thanks, Mary. We're really excited to be here with y'all today. Appreciate the introduction, and always excited to be part of the work that Asha is doing. As Mary said, my name is Dr. Wenimo Okoya, and I'm joined by my colleague, Emily Bader. So I'm gonna go ahead and just jump into the presentation, and then Emily and I are gonna kind of tag team this, and then we'll take questions at the end, but excited to have y'all here today. If you have questions, go ahead and put them in the chat. And we'll keep track of them and make sure that we get to as many as we can at the end. So please bear with me as I share my screen. Sorry. Sorry, I'm having an issue with my second screen. Sorry, give me 1 second. All right, here we go. Emily, can you give me a thumbs up? We're good? Okay, thank you. All right, so we're going to talk to you today a little bit about our work, which we have launched this program that works with high schools, implementing a comprehensive approach for mental health prevention and suicide, for mental health promotion and suicide prevention in high schools over the course of the last year or so. So Emily and I are both new to the high school team, and excited to share our work with you and hopefully give you an opportunity to reflect on how you could bring some of this into your work. So here's our agenda. We're going to talk a little bit about the Jed Foundation and who we are, what we do, talk about the link between mental health, student achievement, and resilience, and describe the opportunity for schools to intervene on student mental health and share our comprehensive approach with y'all, and then review some overarching strategies that we use to promote emotional well-being and prevent suicide in high schools. So our mission is to work with high schools, colleges, and universities to promote overall emotional health for students and prevent suicide. So we partner with high schools and colleges and universities and have been doing our work with colleges and universities for about 20 years and have our work with high schools is newer, but it's built on the foundation of what we've done with colleges and universities. So we do a lot of work around direct work with schools. We also do community awareness building and campaigns, but all of our work converges on promoting emotional health promotion and preventing suicide for young adults and teens. Just a couple of stats, and take a breath as you go with me into these stats because some of them will be pretty heavy, but I think it's important for us to start with the data and for us to have a realistic picture of where we're starting from. So about 1 in every 5 young people have a mental health condition right now, and about almost 50% of them aren't getting the treatment that we need. And to us, that's really concerning and signals an opportunity. And then to complicate things in our current educational landscape, we have remote learning and increased isolation due to COVID, increased bias and hate incidents, challenges with institutional leaderships, lots of protests across the country, racial trauma from negative media exposure and violence, and then increased xenophobia as a result of the messaging about the COVID-19 pandemic. So all of this, you can imagine, is hurting students and making things more difficult for schools. So those of you working in schools have seen these come to fruition and have understood and are beginning to understand how these are affecting students. And then we always want to note that there's additional risk for students of color, students who are LGBTQ+, international students, first generation, and other potentially marginalized groups. They have additional mental health stressors that can place additional risk on them for adverse outcomes with regard to their emotional well-being and mental health. I'm going to highlight a couple of disparities. This graph here talks about spikes in anxiety and depression for Black and Asian Americans after the killing of George Floyd. So as you can see that in Black Americans and in Asian Americans, there's a large spike in anxiety and depression. So that is concerning, but I think that this is really highlights the mental health impact of what people have been experiencing in the media. It's difficult for adults to hear this information, but that much more difficult for young people. Here's another graph that talks about disparities and highlights that anxiety and depression symptoms have more than tripled with Black Americans shouldering the heaviest burden. So we really prioritize the mental health of all students, but want to really highlight for our schools the disproportionate impact of things that are happening in our world on young people who come from different backgrounds. Notably here that Black Americans are shouldering the biggest burden with regard to spikes in depression and anxiety, and that's concerning. And then sat on suicide with regard to Black children between the ages of 10 and 14. It's the third leading cause of death or it's the second leading cause of death for that age group, and the third leading cause of death for Black adolescents between the ages of 15 and 19. So this is alarming for us, a crisis that we really need to pay attention to, and we really have an opportunity to do this in our work with schools. And then pointing out another marginalized community, LGBTQ youth, about almost 50% of them engage in self-harm, including 60% of transgender and non-binary youth, and 40% of LGBTQ youth that were surveyed have considered attempting suicide in the past 12 months. And it's more than half for transgender and non-binary youth. So when we're thinking about working with students, obviously there are some things that we need to consider for all students, but thinking about working with students from underrepresented groups, BIPOC students, and LGBTQ plus students, there are some other things for us to consider, because their needs are not often considered as we're developing interventions. And then this slide, I think, really highlights the intersection of these two things, the intersection of being a person of color, a young person of color, and being LGBTQ. So that this race-related stress increases their suicide risk. So they're shouldering the burden of having two identity groups that are marginalized. So we also need to think about that as we're thinking about intervening with young people. Couple more slides on stats here, but I think this highlights treatment, right? So we've talked about the issue itself, and if there's a disparity and people are getting the help that they need, that would be great. But it seems like based on what we know about stigma with Black, Latinx, Asian Americans, that the treatment rates are lower for students of color. And so we need to really think about how to get those young people into care. Part of that is tied to the fact that there are very few clinicians of color, so it's hard for them to find clinicians that look like them. And then there's also a lot of stigma in certain communities, right? So really need to consider that when intervening with these communities. But I want to leave you with something optimistic, as I've thrown a bunch of really negative stats at you, is that our work is rooted in belonging, making sure that students, when they go to school, feel as though they belong, that they can be resilient over their adversity with adequate support. And so this slide is meant to be a message of hope that if we intervene now and really put the right supports in place in schools, that we can really see young people kind of overcoming this moment. So with that, I'm going to pass it to Emily to talk about the moment we're in and a little bit more about our work.
Thanks so much, Wenimo. So the good news is also that we are in a critical moment, right? Schools are finally starting to pay attention to student mental health and recognizing that it's absolutely a part of comprehensive education. Can you click, please? So we can't focus on education unless we intervene on mental health. The Jed Foundation was interested in learning a little bit more about how schools were or weren't supporting student emotional well-being. So we partnered with Fluent Research to conduct some quantitative and qualitative research with high school students, caregivers of those students, and also school administrators from across the country. And this study included over 1,000 high school students, grades 9 through 12, and their caregivers, and also over 450 school administrators. And the sample represented a demographic mix of participants in regards to gender, race, ethnicity, geography, and income. So I'm going to be sharing some of those slides, some of those data points on the next couple slides. And it's also important to note that we conducted this research in 2019, so prior to the COVID-19 pandemic. So it's no surprise that the study found that student mental health needs were both significant and also not being fully addressed in schools. And you can see some of the key findings here, but I will also be reviewing some of the data a little bit more specifically on the next couple slides. But overall, the study validated that now is the time to address the needs of student mental health, better support school administration, and provide caregivers and families with the tools that they need to support their young people at home. And it also validated that leaders, counselors, students, and caregivers are ready for increased support around mental health. Now we're going to dive a little bit into the data. So next slide, please. So school administrators identified mental health as a key issue. Administrators reported that student mental health issues were on the rise, more so than physical health challenges. Frequently occurring mental health needs for students included anxiety, difficulty coping with stress, difficulty managing emotions, and using social media in an unhealthy way. Additionally, students also reported anxiety as a top problem as well. Again, since this research study was conducted in 2019, there is evidence that stress, anxiety, and other emotional issues are even more prevalent among students in the wake of the pandemic. In addition to students reporting their own anxiety, they felt that their peers didn't know how to cope with stress. They didn't know where to seek help for mental health issues. And they even were unsure of the signs of suicidal ideation in both themselves and in their peers. Additionally, students from low-income households were also found to be at greater risk for mental health challenges. Next slide. Both school administrators and caregivers believed that it was the school's responsibility to address mental health and emotional well-being. This was especially true when it came to educating students on how to reach out for help if they needed mental health services. Also, over half of administrators and caregivers agreed that it was the school's responsibility to make efforts to prevent suicide among students and talk about suicide at school. I'm going to hand it back over to Wenimo to talk a little bit about Jed's comprehensive approach and how we're helping schools intervene on student mental health.
Thanks, Emily. So, we really believe in taking research and evidence and pushing it into practice. So when we're working with schools, we are thinking about how to apply what we know about what's going on with student mental health and what we know about what's necessary to improve the infrastructure of the school to support student emotional health and prevent suicide. So our comprehensive approach, which is featured in this wheel to the right, is focused on 7 key domains, which Emily will dive into a little bit more in detail. But we have these 7 broad domains: so development of life skills, promoting social connectedness and positive school climate, encouraging help-seeking behaviors, improving the recognition and response of signs of distress and risk, ensuring students have access to effective mental health treatment, establishing and following crisis management procedures, and promoting means safety or access to lethal means for suicide. And we don't prescribe a method to schools. We have a technical assistance model. And so we're using the school's data to get a sense of what they're doing really well and figuring out what their areas where where we could fill some gaps, and then aligning that to our comprehensive approach. You'll see the outer ring of this is equitable implementation. So we believe that we need to lead this work with equity, and that equity needs to be a through line in our approach. And that we do this through a strategic planning with a interdisciplinary team that includes a diverse set of stakeholders. So we're constantly recruiting high schools. We want to make sure that this work is pushed out to as many schools as possible. And we have currently have 22 schools that are working with us, and a couple more signed on to begin working with us in the fall and next school year. So we've been excited to launch this work in the last school year, and we'll go into more detail about this moving forward, but this is really the foundation of the Jed comprehensive approach, which takes that data on what students need, what we know schools need to put in place in order to bolster the emotional health environment of the school and prevent suicide, and putting that into action. So here's kind of a broader overview, kind of in a timeline. So we have an assessment. So we work with an interdisciplinary team. So that can include teachers, parents, students, social workers, guidance counselors, administration, bus drivers, cafeteria staff. Anyone who can speak to the emotional health environment of the school can be on the interdisciplinary team, because we really want to get a diverse perspective of what's going on in that school. And that group of people, their first task is to do an organizational assessment with the school. And that organizational assessment is aligned to our 7 core domains and gives us a snapshot of what's going on sort of a population level of the school. We then administer a student level survey called the Healthy Minds Study that we've developed in collaboration with the University of Michigan, their Healthy Minds team. And that gives us a sense of what's going on the student level with regard to our 7 core domains. So how are students doing? And we take that data, roll it together, and create a feedback report and a strategic plan. We do a virtual site visit with the school or in-person site visit, hopefully in the future, to get a sense of, to get a better sense of the school environment, and then work with the school to develop a strategic plan that they implement over the course of 18 to 24 months. That they then get access to a learning community, which includes our webinars, newsletter, training, and access to other schools implementing Jed High School. And we work with them to do follow-up evaluation and build a plan to sustain the work after we have parted ways, but they always remain part of our learning community. So Emily, again, as I said, is going to go into a deep dive of the comprehensive approach. This is a good time to put questions in the chat because we've said a lot of things and a lot of data. So feel free to put questions in the chat and so that you don't forget them, and we'll keep going.
Thanks, Wenimo. Can advance. Okay. So before we dive into the domains, I just want to share this image. We always start our work with schools with a conversation around equity. So I'm sure that some of you have seen this image before, but just want to level set with some definitions. So equality is providing everyone with the same exact resources, and equity is giving everyone the resource that fits for them. So in the top image, we see that everyone has the same exact bike, regardless of if it fits them or if it's right for them. And then below, under equity, we have 4 individuals who have bikes that were tailored for them. So as Wenimo mentioned earlier, why this is so important is that the research shows us that BIPOC students, LGBTQ plus youth, international students, first-gen students, and other marginalized populations may be at higher risk for mental health challenges, bullying, and suicide. So it's important that in our work with schools, the interdisciplinary teams keep these groups at the forefront of the conversation, as we know that many of our schools were not designed for so many of the students that we serve. And when we're thinking about interventions that support all students, we really want to keep some of these groups in mind. Next slide. All right, so I'm going to start with develop life skills. So we know that well-developed social and emotional skills act as protective factors against stressors, improve academic performance, classroom behavior and attitudes, and increase school engagement. Teaching life skills in schools can also reduce symptoms of anxiety and depression, reduce substance misuse, and suicide risk. It's important to keep in mind that SEL really has to be woven into the fabric of the school's foundation. Teachers, support staff, administrators really have to self-manage and role model, or it just won't work. It really needs to be integrated for teens with real life participatory problems. And that's the most effective way that it's going to stick for students. It really has to be integrated into the content of the class. An advanced slide. Okay, so next we have promoting social connectedness and a positive school climate. So the research shows us that students who feel connection and belonging are less likely to experience distress and engage in substance misuse or suicide attempts. School climate and the feelings of safety it can provide improves for all students, specifically when schools pay attention to improving climate and safety for those students who are most marginalized. Also, when we think about utilizing an MTSS approach, creating a positive school climate is one of the ways that we can just reach that tier 1 group, so that bottom portion of the pyramid, which is about 80% of the school community. Encouraging help-seeking behavior. So the research shows us that about 1/3 of students with reported mental health challenges only 1/3 of students with reported mental health challenges seek and receive treatment. And help-seeking behavior is even lower for students from underrepresented communities. Delays in the help-seeking process can lead to adverse health outcomes, including substance misuse, increases in high-risk behavior, and suicide. And just some barriers to help seeking that we have found through our research that I want to share with you all. So young people report that they're unsure of what mental illness is or what mental health services are even available to them. Young people are worried about costs, they're worried about privacy, and also a counselor or therapist's ability to actually help them. Young people rate embarrassment at the top of the list of why they don't seek help. They're concerned about being stigmatized by their peers or by adults, and also cultural considerations. And this might include mistrust in the healthcare system as well. Something also important to note in terms of help seeking, we know that more than half of adolescents, particularly male adolescents, use social media or digital sources for information on health and mental health. So it's really important to think about how we shape the conversation around social media use. We want to empower youth and highlight youth voices if we're encouraging that behavior. Next slide, please. Improving recognition and response to signs of distress and risk. The majority of young people who die by suicide are struggling with untreated mental health challenges. So it's really imperative that school communities include early recognition of these challenges, mainly through gatekeeper approaches and screenings. Gatekeeper training should be comprehensive, and they should also be open for everyone who interacts with students. So this might be sort of outside of just administrators and teachers, but we really want to include support staff, coaches, even custodians, parents, young people. Anyone who interacts with students has the opportunity to understand what it looks like when someone's in emotional distress or showing signs of suicide. Also, gatekeeper programs and referral practices that include trusted community members outside of the school are likely to be more effective for BIPOC, LGBTQ+, and other underserved youth. Next slide, please. Ensuring access to effective mental health treatment. So we know that schools are well positioned to provide and facilitate access to mental health treatment. So if mental health treatment is being provided in school, then providers must be properly credentialed and supervised. The provider should be culturally competent and also assigned provider to student ratios that facilitate effective care. So typically the number is 250 students to one mental health counselor. That's the recommended ratio. If high schools are not able to offer in-house mental health services, then they should partner with regional providers and or telehealth providers to make sure that those students are actually able to be seen. Treatment modalities and approaches that are the most effective take into account students' identity and cultural social context and are also responsive to student and family schedules. So wanting to make sure that you're really understanding the student's needs and taking those into account, especially when you're referring to an outside provider. Establish and following crisis management response and procedures. So schools must have a process for providing support to students who have been identified as being potentially suicidal. This is critical to a comprehensive suicide prevention approach. In addition, comprehensive crisis management procedures should include plans for responding to incidents that might impact safety or mental health needs in schools. For example, the death of a student or a community member, violence at school, a natural disaster, or an accident. These types of events require immediate intervention and longer-term follow-up to mitigate ongoing risk and promote healing. It's also crucial that there's clear communication and a team approach. This can ensure that there are less negative effects on student mental health. Next slide. Okay, so our last domain is promoting means safety. For adolescents specifically, the research shows us that the experience of suicidal thoughts is actually relatively common, but the process of moving from thoughts to suicide behaviors is far less common. It's important to conduct environmental scans and educate school communities, including families, on lethal means safety. Space and time from lethal means is one of the most effective ways to prevent suicide. So it's really important that we're helping families and communities understand how to make sure that lethal means are safe so that they're able to create that space and time. Next slide. So I have just thrown a lot of information at you. So we're hoping, go back one more slide. One more slide, perfect. So I have just thrown so much information at you. So before we move into the Q&A, we're curious to hear from the group if anyone has ideas about how you can incorporate some of these strategies into your practice. You can just go ahead and type that in the chat.
Let me just look like we have any questions yet. Would you like to start with the questions and see what comes up?
Sure.
Okay, one of our questions is, what type of suicide prevention training do you do or recommend, such as QPR or mental first aid?
Yeah, thank you for asking that. So QPR is a great method, and we actually have been trained in that here at the Jed Foundation. So we would recommend QPR or also signs of suicide or something similar to those as well. And it's important to keep in mind that these types of trainings, you don't have to be a clinician, anyone can be trained. It's really important to just ensure that the individuals being trained are able to identify if someone's in emotional distress and then know what to do with that information.
And does anyone else have questions? I'm going to ask a question myself. My husband's an elementary school teacher, and one of the things he's concerned about this fall is the number of students whose families have chosen not to be vaccinated, and how they're going to feel emotionally within their classroom. Are they going to feel ostracized by other students whose families have chosen to be vaccinated? And what you think impact of that might be?
Yeah, that's a complicated question. And I think we have to, it'll be a little bit of wait and see, but I'll just link it back to what we said about belonging and student belonging, because regardless of what the factor is, it's important that students feel as though they belong in school. And so we'll have to do a lot of work with schools to build an infrastructure where students feel both that they're physically safe and then also that they belong regardless of the choice that they've made. So I think a lot of that can happen in terms of development of life skills domain, right? Like talking about differences, understanding that that schools need to build in systems in place to have those conversations with students rather than sort of telling them to stop, but just having real conversations about that and not discouraging those conversations from happening.
Comment that we had. I think one of the largest barriers to the willingness for youth to reach out for help is them not knowing their rights. How can we get teens to be more aware of their rights to seek limited care with confidentiality?
Yeah,
go ahead. Emily.
Sorry, go ahead. Oh, okay. So this is a great question, and something that we talk to schools about a lot. So we really encourage schools, counselors specifically, to make that clear to students and say to them, you know, this is a confidential space. If you come here and you share something going on, you know, I'm not going to pick up the phone and call your caregiver. I'm not going to share it with anyone else. Of course, there are limits to that as a mandated reporter. So making sure that the students are clear on the types of things that, you know, will have to be reported or revealed to others and what can be kept confidential. With that in mind, just because a student shares something that a mandated reporter would have to share with someone else, they can also include the student or include the student's input in that process. So for example, if a student shares that they are harming themselves and a counselor at school thinks that maybe the caregiver should be informed, they can speak to the student and say, you know, what you shared with me is something that I think that your caregiver should also know about. Do you want to share? Do you want me to share? Do you want to do it together? What would make you feel, you know, safe and comfortable, and not just make that decision without the input from the young person?
Yeah, that's really well put, Emily. I'll also say in addition, there's sometimes young people don't even make it to the counselor's office. So another part of what we encourage schools to do is build campaigns around help seeking, right? And building in systems so that young people, there's a school that we work with that has an anonymous system for referring a friend to care. So they know who the people in the building are, who can help and support them. So putting posters up in the school around who those people are, having those folks in the building wear badges, just so that young people know who they can go to, understand what to expect when they go to that person, and then also give them opportunities to refer each other. So these are all sorts of things that we've seen in our schools.
Another comment, our program provides free suicide prevention trainings for all school staff and communities within our service area. We also provide presentations. We created a resource listing and provided the listing quarterly to the schools. And at all our trainings, we also provide support in getting started a youth-led after-school program to promote positive activities that encourage for all of our participants. So that's something someone has taken on and done with their groups.
That's awesome. Would you be able to share the name of your program? And also where you are, just curious. It's awesome that you're doing that incredible work.
Waiting for comment.
You don't have to, it's confidential. Maybe it's a secret.
Like me, they can't type fast enough. It is Youth Substance Abuse and Suicide Prevention Program with the Winslow Indian Health Center in Winslow, Arizona.
Oh, awesome. That's why it took you so long to type it, because it's very long. Thanks for sharing, and thank you for the great work.
I noticed one of the areas that people commented on was the information around equity and equality from the Robert Wood Johnson Foundation. Might go back and just mention that again, because I think that really resonated with some people.
Yeah, I can go back to the slide, but every conversation we begin with schools begins with equity. And this just helps us to illustrate this. Equitable implementation is a part of our model. So it's this outer ring of our approach, because we believe that it's a through line for all this work. So we're wanting to have schools think about the development of life skills, about social connectedness, about help-seeking behavior through the lens of equity, right? Through the lens of which students were the bike not designed for. And we believe that if we design schools and systems and interventions for people who have the least access, we develop better outcomes for everyone. So an example of that is, did you give us already, Emily, sidewalks? No, okay. So, architects are really great at universal design. They've developed sidewalks with ramps, so that with people in wheelchairs in mind. But that sidewalk ramp helps someone who's on a bike, helps someone who's pushing a laundry cart, helps someone who's temporarily on crutches because they might have broken their ankle or something like that. So by designing with people who have the least access to the system, you develop better intervention for everyone. So we really try to help and push schools to think about, how can you think about the students who are the most marginalized in your community? Is it students of color? Is it LGBTQ plus students at the intersection of those two identities? Is it students with disabilities? Students whose families may not speak English? Thinking about the students who have the least access is not going to make you forget the other students. Their experiences are inclusive of students who schools have typically been designed for. Sorry, go ahead, Mary.
I was to say that's wonderful, because it does affect the youth's mental health status if they have to be singled out to say, I have a problem with this, rather than recognizing it beforehand.
Exactly, yeah. And all the data tells us that they're forgotten, right? And that they're at higher risk. And we should be the ones, as the designers of the system, we're responsible to think about that, right? And we're responsible to intervene.
I had a question. Could you share your research instruments or your research results?
We can share, when we send the follow-up survey, we can send the Fluent research report with that, or the follow-up slides. we're happy to share that with Caitlin.
Anyone else have a question?
This is Caitlin. I'll just add that at the end of the webinar, we'll have an evaluation for everyone, but I also want to let you all know that an email will go out within the next day that will have the slides as well as any resources and the recording of the webinar, so you can check it out again in case you may have missed something.
Yeah, our participant from Arizona has shared, look into the Sources of Strength program. They are very awesome.
I think we actually have them in our playbook. So thank you, Luana. We have a playbook of resources that we share with our schools. And I do remember reading about them. So thanks for sharing that. It's great that, and if anyone else in the audience has resources to share, we're constantly looking to learn. So yeah, please share. There seems to be tons of folks doing amazing work out there. Great. Emily, do you want to kind of go through and share the rest? Do we have our resources on here? I'm going to go through these.
Sure. So we will just end off with a couple resources. So our website's always a really great place to check. We had a ton of resources for students, young adults, parents, guardians, high school and higher ed professionals. So just about everyone, for COVID specific resources and also general mental health resources as well. So check out our website for sure. And then we have the Love is Louder campaign, which is just promoting positive mental health and is really good for any teens who are interested in a teen specific facing campaign to check out Love is Louder. And then we have our Seize the Awkward campaign. So this is all about seizing that awkward opportunity and asking someone if they're doing okay in terms of their mental health. So seizetheawkward.com has a bunch of conversation starters and prompts specifically for young people to ask others about their mental health. And this was in partnership with the Ad Council, this campaign. So this is our Set to Go program. So Set to Go is actually our flagship high school program. And we recognize that young people who went off to college or graduated high school and went off to the military or started working were actually not quite emotionally prepared for that transition out of high school. So we created the Set to Go to meet some of those needs. So these are different modules for students, families, and educators that help students be more prepared for the emotional transition out of high school. And these modules are all free and can be found on our website. And then this is just our Instagram, which has resources and different articles and information that you can find as well. All right, so that's it. Caitlin, I guess we can give everyone a little bit of their time back this evening.
I'll go ahead and share the last bits of information from Asha. This is a reminder that you're eligible for 1 hour of continuing education, either entry continuing education hours, entry level continuing education hours from InCheck, 1 NAP contact hour, or participation. Of Asha receive free continuing education credits. CEs may be obtained by completing the webinar evaluation that will be sent out. We have some more upcoming webinars. We have the WISC model implementation in elementary schools through a county health department on August 5th. On September 21st, we're going to look at the whole child approach to wellness, the RAILS model evaluation. And on October 5th, puberty education, building the foundation for healthy sexual development. Again, I want to remind everyone that the American School Health Association annual conference is coming up, and you can register by going to www.ashaweb.org. And I want to thank our wonderful presenters today and all the great information they were able to share with us.
Thank you. Thank you all for joining us. Have a great day.
Thank you all. Have a good evening.